Hello, I'm a specialist, physiotherapist and rehabilitologist, Associate Professor Hülya Şirzai, a physician of the Romatem Health Group. First of all, we would like to express our gratitude for participating in the organization on behalf of Dr. Göksel Kologlu, Chairman of the Board of Directors of the Romatem Health Group. Our journey began in the city of Samsun in the year 2005 as a health club Romatem, where we provided physical medicine in rehabilitation. After that, we started working as a network of Romatem hospitals in the city of Kocaeli, in the city of Bursa, in the city of Istanbul, Hülya district, and in Azerbaijan, in the city of Baku. Our goal is to help our patients in all aspects of physiotherapy and rehabilitation, especially for spinal cord injuries, cerebral vascular diseases of the brain, infantile cerebral palsy, neuromuscular diseases, neurological diseases, sports injuries, meniscus injuries, ligament injuries, different fractures, where we provide rehabilitation, orthopedic rehabilitation, rehabilitation after sports injuries, and prosthetic rehabilitation. We also treat cardiovascular diseases, respiratory diseases, and in particular, we provide rehabilitation procedures for post-COVID patients. We provide a high level of services of vascular rehabilitation in respiratory dysfunction. That is possible thanks to our experienced physiotherapists and rehabilitation specialists, occupational therapists, speech therapists, and thanks to the pro-rehabilitation effects that can be achieved thanks to the latest scientific advances and using the latest modern technological devices for our patients. We provide treatments using our modern technological systems. For example, on-the-go system for gait training. Our device supports the daily life of our patients with walking and balance problems, which are caused by neurological, orthopedic, muscular, cardiovascular, and other reasons. In our hospital, we provide maintaining the weight in the dynamic state and in versatile movements, in functional walking, in effort to stabilize balance. Supportive rehabilitation systems, which are partial discrete gait assisting systems, provide much better effect compared to other fairly large systems, and which are very important for both gait analysis and gait training, or inverse balance in upright posture training and balance training with our systems, which make it easier for patients to walk in place. Our robot assistant walking therapy Locomat system teaches robotic walking. In other words, it is a robot-assisted system that is intense, fast, and functional with a rhythmic, intense, and motor mode to restore the walking functions. We help teach and maintain motor control with the help of these devices. We stimulate plastic changes in neural connections by repetitive movements. The device that we use for walk-in sites, especially for neurological diseases, sport injuries, and pulses. Romatem is a rehabilitation device that is used for robot-assisted rehabilitation. It is used in case of impaired motor function of the distal upper extremities with limited movement in the fingers. The device simulates the movement of natural grip and movement of the hand using a patented mechanism. Movement and strength can be adjusted according to the needs of the patients. We have other robot-assisted devices to treat arms and hands. Our robot-assisted device, Armea Power, provides the function of controlling the other hand. We provide therapeutic services with the possibility of physiotherapy without increasing the intensity of exercise. During the mechanical measurement of the strength of the muscles in the upper extremity during movement in the joint and during mechanical action in the joint, this device is safe. That is very important for patients with acute and chronic diseases. Erigobert System Project. These are the first robot-assisted bed systems that provide early physiotherapy for bedridden patients who cannot move. At an early stage, the patient holds the robotic bed with a physiological position and, on the other hand, with the help of robotic legs to prevent the development of stiffness and rigidity in the joints. That helps to start gait training. Rehabilitation based on the robot-assisted technology used at Erigo avoids problems such as pressure sores, which is a side effect of immobility and are quite rare with Erigobert System Project, which allows the patient to regain the lost mobility as early as possible as a wearable walking robot exoskeleton. This is our rehabilitation system that greatly contributes to both the motivational and mental states of our patients with neurological and orthopedic injuries, muscle diseases, or muscle weakness, so that our patient can walk normally and move freely. We use our TRX 9000C device for spinal decompression, in particular for neck and lower back pain, especially in patients with normal and severe hernia of the lower back and neck. The device is used for patients in the treatment of hernias without surgical intervention, and in general, we have a success rate of 74%. Our hydrotherapy procedures are designed for our patients where we use the mechanical, chemical, and thermal properties of water that allow patients performing exercises in the form of treatment are the therapeutic method that helps to comfortably cure the diseases of the musculoskeletal system, nervous system, respiratory system, cardiovascular system. The procedures provide stretching and relaxation, and we use them to increase the range of motion of joints in acute and chronic pain, to strengthen muscles, to increase flexibility and muscle contraction, especially in patients with hemiplegia, patients with cerebral palsy, patients with Parkinson's disease, and patients with difficulties with walking. Manual method for treatment of diseases and treatment after sports injuries. We provide mobilization of joints in manual therapy. We provide mobilization of nerves. And this is our special system that we use to relax soft tissues. We also use it for supportive therapy, especially in the case of painful injuries, for orthopedics, at relaxation and restoring sports activity. In addition to that, in all our hospitals of the Romatem Health Group, we provide treatment for connective tissue diseases such as rheumatoid arthritis and ankylosing spondyloarthritis, which is provided on a comfortable basis for the patient. In our occupational therapy and rehabilitation, we do foot treatment, scoliosis treatment, we provide acupuncture and other treatment. We also conduct shockwave therapy sessions using high-intensity laser therapy, kinesiotherapy, and we offer these procedures to our patients at a high-quality level of services. Thank you for your attention to my presentation and to our Romatem Health Group.